Hello and welcome to Los Omes's free webinar series. Tonight's webinar, Neuro-acupuncture for treating difficult neurological disorders, featuring Dr. Jason Howe. My name is Todd O'Leary and I'm the moderator tonight. Dr. Howe, thank you so much for doing this for us tonight. We appreciate it.
Thank you.
Yeah. How are you doing tonight? All good?
Excellent.
Excellent. Good to hear. All right. Before we get into this evening's content, let's take a moment to acclimate ourselves to the webinar room. To the bottom right of the screen, you'll see two tabs, questions and chat. To connect with other attendees or notify us of any difficulties you may have, please use the chat tab. At the end of the presentation, we will use that chat tab to post a promo code specific to this event, as well as a link to watch Dr. Howe's documentary, Return to Life. If you have any questions for Dr. Howe, please use the questions tab. Your questions will be presented to Dr. Howe at the end of the lecture during our Q&A session. Please note that each webinar is recorded, and immediately following the conclusion of the webinar, you will receive a link to view the video on demand and a copy of the slides. Dr. Jason Howe is editor-in-chief and translator-in-chief of the textbook Acupuncture and Moxibustion, published by World Federacy of Chinese Medicine Society. Dr. Howe currently serves as the vice chairman for the Education Guiding Committee at World Federacy of Chinese Medicine Society. Dr. Howe is the president of the Neuro-acupuncture Institute in the U.S. He was former chairman of the acupuncture committee at the National Certification Commission of Acupuncture and Oriental Medicine, the NCCAOM. He is the co-author of the book, Chinese Scalp Acupuncture. Dr. Howe has been practicing and researching neuroacupuncture for 40 years and has been teaching classes and seminars in the U.S. and Europe since 1989. Dr. Howe gave a neuroacupuncture seminar at Walter Reed Medical Center in Washington, D.C., where he successfully demonstrated scalp acupuncture treatment of CRPS and phantom pain for veterans. Dr. Howe specializes in treating neurological disorders such as stroke, multiple sclerosis, traumatic brain injury, PTSD, cerebral palsy, autism, complex regional pain, and phantoms. Many American newspapers, journals, and television shows have reported on his successful cases and stories over the past 30 years. The film, which you're going to be getting a link to, Return to Life, will give you a preview of that during this webinar. It's by Doug Dirth and was released in May of 2021, and it documents Dr. Howe and his wife, Dr. Linda Howe's treatment of patients suffering from PTSD and other physical complications. Welcome, Dr. Howe.
Thank you very much, Todd. A very beautiful introduction. I will also take this opportunity to thank the LASA company, the backstage, Stephen, and also our executive director, Asia, and to help put everything together.
Excellent.
Happy New Year, everyone. I'm Jason Howe, the president of Neuro-acupuncture Institute in America. Very glad to meet you here. I see the chat. Everybody say hello there. Thank you so much. And thank you a lot for joining us to celebrate this special moment to talk about how we treat some difficult challenge neurological disorders. We can start our PowerPoint. Before my lecture, I'd like to ask you questions. You probably come here to want to learn something new. My questions, do you have experience treat some challenge disorders, like people paralyzed, like people lost speech, like people have cerebral palsy, autism. Do you confidence you can treat them? Do you want to have some revolutions in New Year 2023? Not only treat the pain, you want to treat something. Even Western medicine knowledge, doctors don't know how to treat it. If you want to know this, and today this lecture is your answer. They're not going to change your life, your practice through your hand. You're going to treat a lot of people, change many people's life. Next slide, please. So I'm going to use this hour to introduce some interesting cases related multi-challenge disease you don't meet very much or you don't treat very much. Also, in past 3 years, the world have gone through many challenges for pandemic. They affect our life, affect economics, educations, and medical practice. You know, the whole world multi-phase, a lot of people after post-COVID and vaccine still have symptoms and signs. They call low hauler or post-COVID syndrome. And so scalp acupuncture, neuroacupuncture, I do have wonderful results. So I will save some time to do that as well. Next slide, please. As Todd introduced me, I'm in America 33 years and many newspapers, TV, journals, and radios have reported us. You can type in Jason Hao neuroacupuncture. I think more half the page is our institute. So you can get a lot of information about that. This is some of the newspaper in the past. Next slide, please. So I've been traveling all over the world, include Dubai, Europe, Australia, Canada, many different countries, Australia, to introduce neuroacupuncture. 8 years ago, we established our own institute, Neuroacupuncture Institute in America. Then we have 3 continuing education level trainings. Each level has 3 to 5 different classes. For more information about our trainings, our class, please visit our website, neuroacupunctureinstitute.org. This is some of our graduate students. They really like it. They change a lot of people's life and themselves' life as well. Next slide, please. So, most important, today we need to know what is neuroacupuncture, what different from other acupuncture. So you need to know the definition and concept. Neuroacupuncture is a contemporary acupuncture technique integrating traditional needling stimulation technique with Western medicine knowledge, neuroanatomy, neurology, and neuroscience. Neuroacupuncture has been proven to be a mostly effective technique for treating central nerve disorders, include stroke, multiple sclerosis, Parkinson disease, PTSD, traumatic brain injury, phantom pain, cerebral palsy, autism, and post-COVID, post-vaccine syndrome. Neuroacupuncture often produces remarkable results with just a few needles. Sometimes they only take several minutes to achieve major improvement. This is only our lecture, so we only introduce some of them. You want to learn more? Neuroacupuncture, scalp acupuncture, please visit our website, website also you can get this book. Those books were published in 2011 by Jason Howe, and my wife, Linda Howe. There's a very good book for learn scalp acupuncture, and many acupuncture schools all over the world have used that as a textbook. Next one, please. So that's just some example. We can treat many diseases. And in the past 30 years, there's many movies, radios, TVs report us. Last year, there's a new movie directed by Doug Dird. He's a director for famous movie 9,000 Needles. So he finished the movie. Movie recorded our success story to treat neurological disease. And I'm going to introduce some of them. The important, this movie, not only for you education, is also wonderful marketing tool for you directly to your patient and other professions, doctors. For free link, you can check in the chat, and our director put a free link, and you can go to our website and contact our executive director, Asia, then you get a free link. Otherwise, you have to pay $5 or $10 to rent it on that. Also, either way, remember, just go to website, Neuro-acupuncture-institute.org. So that film is released, get wonderful responses. Hopefully you like it. We like your feedback. And that poster is very professional. And we have some movie have Chinese subtitle as well. Thank you. Next. So there are many patients in the movies. I'm going to introduce a few of them, give you an example how we approach to treat it. That is Jack, and is a 43 years old veterans. And when I start treating him, he already injured for 13 years and disabled. His vehicle exploded, then he have severe neck injury, headache, neck pain, insomnia, anxiety, depression, and cannot do anything. He has wonderful responses. He's a major patient in entire movies. So after 2 treatments, his all pain go away. He cannot believe that. After 4 treatments, all gone, all symptoms. So he have normal life, and he back to work, enjoy the life. Now he have 2 kids. Before, in the movie, don't mention that. He has severe fatigue, don't think about any activities that include sex. So after that, everything normal, very exciting. I hope you enjoy to meet him in the movie. So for him, I only do scalp acupuncture. Scalp acupuncture includes the neuro-acupuncture includes scalp acupuncture, ear acupuncture, and body acupuncture. We did not use traditional theory, Zhang Fu, channels, meridians, yin yang theory. We based everything on neurology, neuroanatomy, and neuroscience. So the location, diagnosis, evaluation, all based on Western medicine knowledge. And in our class, teach major is a scalp acupuncture. Then we invite the professor from all over the world, teach neuroanatomy, neurological examinations, herbs, And body acupuncture, for example, is a wonderful class. And please join us and to learn more. Next. So for him, and I use ear treatment and heart work. For the scalp, I use photomotor sensory areas like here, and use a head area in the middle, and some pain, I use upper 1/5 sensory areas. That chart, it comes from one of the textbooks called scalp acupuncture. So by modifying all these location, we almost can treat every neurological disorders. So it's 17 areas in gel style scalp acupuncture. So this class, I major focus on gel style scalp acupuncture. But in our class, I teach a fun style, a U style, and my own style called hot style scalp acupuncture. So for this class, if you know this, it's gel style scalp acupuncture. Next slide. Only 17 areas. Many of them probably have already treated a stroke, and they have wonderful results. And that most people know, scalp people work on for this kind of condition. But many acupuncture have a challenge to the people who have multiple sclerosis and the Parkinson's. So I'm going to introduce a few patients about that. This is one patient I see 14 years ago. He's a lawyer, 65 years old. At the time, he had multiple sclerosis for 20 years and 12 years disabled. He basically had it, fatigue, trouble walking because the leg is stiff and weak. Also balance terrible. Yeah, he had to use a cane to walk. He had double vision loss, almost legally blind, cannot see, and weakness of both his legs. Next, please. During the first treatment, his balance is much better. So I put upper 1/5 motor areas, foot motor sensory areas, and the balance areas, and vision areas. For those multiple sclerosis and Parkinson disease, I use ear acupuncture as well. Most common, I use Shenmen and liver first. In TCM, all the MS, Parkinson, they're all tremor movement disorders, so that's good for them. So after first treatment, his balance almost normal. So his wife cried about that. He has burst into tears. It's very exciting. Have that. After 2 treatments, he have more energy, vision very much better. Later on, he visited his eye doctor. The doctor had been practicing for 40 years. Doctor said, almost cannot believe that. It's impossible his vision come back to normal now. He can read it, anything. After 3 treatments, all his MS symptom signs was gone, have good energy. After 4 treatments, he back to full-time job. Oh, I didn't update this slides. Now there's a 15 years, he have no symptom signs. He don't mind mentioning his name. It's a Stephen Hubert. He's a lawyer for our institute. He volunteered set up an institute. I refer a lot of multiple sclerosis patients to us, include his two sisters. One have dizziness, vertigo, 2 treatment cured, and one have weakness of legs and much better as well. So that him, he is in the movie. Please join to meet him there. Next, please. Many of you probably in the mind, you probably get lucky, Jason. We treat MS, we never get good results. If you know my technique, you will get results. I not only have one, I have at least 20 to 30 people, no symptoms. So, however, MS patient, Parkinson patient, they have some setback. Like a stroke, brain injury, I can cure them. They don't need treatment anymore. And MS, they need to continue treatment. So I see Stephen Huber once a month or once every other month. There's another patient have MS. Young guy, 40 years old. When I start treating him, he have 5 years, cannot work, and have balance problem, severe fatigue, walking not good. And here again, after 4 treatment, all symptoms and signs gone, and he back to work. Now he have 10 years, that's slide not update, and no symptom and signs. He is a police in chief. He working, he jumping around. No people know he have MS. Again, the protocol is very simple. Yershimon, liver first. And then you put upper 1/5 motor areas for leg, foot motor sensory areas, foot motor and sensory areas for fatigue, for many other things. Then you use the balance areas. So it's most common. Of course, you can modify. Many people have MS, could be have tingling, numbness on the leg. And arm, you use a sensory area as well. This patient, his vision is normal. You don't need to use vision areas. For new scalp acupuncture, I usually return the needles for 30 minutes to 45 minutes, and you stimulate the needles every 10 minutes, about 2 minutes, okay? So that MS patient, now in your questions, what needles you use? How do you insert the needles? So there's another important things you need to know. So neuroacupuncture is based on neuroanatomy, neurology, and neuroscience. So for you want to get good results, you need to review the neurology and neuroanatomy. For you don't have much knowledge, I highly recommend you start take some courses and with us or with other resources as well. So basic, we learn the neuroanatomy. You need to know which gyrus is the central deep crack called sulcus. Between the sulcus, the things reach up, they call gyrus. Each gyrus have specific functions that in our class, Professor Richard Scholar will teach you a lot. How to location this, what their functions. Anyway, for example, this gyrus from here to here called motor gyrus, they control the body movement of the sides, okay? left brain control right side movement, right side brain control left side, and each side of brain have their own functions. This control the movement of trunk and the leg and the foot. This portion control the arm and the hand, and this part control the face muscle movement. Each gyrus in the brain have projection area in the scalp surface. Then we learn how to measure that. We can locate this point. For example, for motor area, we just review is in the pink. You locate there from occipital protuberance, connect with occipital protuberance there, then you find the middle point right there. From this middle point, posterior to the middle point, ½ centimeter, you find the upper point of the motor areas. Then from an eyebrow, you make a horizontal line called connect occipital protuberance right here. This line will cross with anterior hairline, and that's the lower point of motor areas. You connect these areas is the motor areas. So when you do the needles, you do this, just from up to down, I put the middle. You do this way, follow the line. Okay? The needle I use is relatively thinner compared to people using in China. So I use this 32, 34 Chinese needles. Most of them I use 1.5 inches, 1.5 inches. And for the children, usually I use 1 inch needles. So it's very difficult to do this. For you beginner, you might be learn just hold the needles like that, okay? And there's a 14 degree, use one hand, hold your needles right there, and there's a 6th hand, right there. 15 to 25 degree horizontal. Stimulation is very important. So you don't do this, okay? You have to do this. You want to get good results, you have to do 200 turns per minute. You close rise, enter close rise. So basically the thumb don't move. You move is this. You move these fingers, okay? And you do it like that. So fast you do, you get good results. You come to our class, each group of students have 6 to 8 students. We have supervisor walking you through. Make sure you can do that without the pain. So a very important insertion without the pain, especially treat the children. You have to put the right layers, and we'll teach you how to do that as well. Okay, that motor areas, behind is the tremor areas, behind is the sensory areas, then in front is the tremor areas. For the Parkinson, that one is blood vessel dilation areas. For people for CRPS, that is the vision areas right here, and that's the balance areas right here. So you can look the book, and you can go online, review what you have to learn. Okay, there's a speech area, speech 1, speech 3, 2, speech 3, treat a different kind of speech. And for this year, last company invite me back, I will talk about people have aphasia too as well. So, okay, we come back to slide again. So, this patient now have no symptoms for about 10 years. So we have many of them. If you come to class, most beautiful essence for the class with demonstration patient and let you see both I, Jason Hao, and my wife Linda how we get good results. Okay, that is a MS patient. Next slide, please. Past 10 years, we treat a lot of children who have cerebral palsy and autism. Have wonderful results. That is the boy I cured many years ago, probably 10 years ago, 12 years ago. When I started treating him, he was 6 years old, has cerebral palsy, diagnosis, he had a stroke in uterus. He had weakness of both arm and hands. Arm and hands so weak when he write with a pencil, nothing in the paper. He had also poor coordination, balance, and when he talk, no people understand him. So for 6 years, basically he disabled, and they kept him in 2 years in kindergarten because he cannot communicate, cannot do anything. He's very cute, very corporate from Amarillo, Texas. And, you know, sometimes we say if you're good, mostly needle doesn't hurt. Sometimes they do. So, but he never complained. Even sometimes I cannot. I know he's hurt. And he say, no, how are you feeling, Jack? No pain. Shaking the head. Next slide. So for him, what you do? Simple. I use multi areas, upper 1/5, middle 2, upper 5/5 for the leg, middle 2/5 for the hand, arm, foot motor sensory areas for everything he have. I use the speech 1 areas right here, and sometimes use the speech 3 areas. Guess what? Each treatment, he shows some improvement. After 14 treatment, he completely recovered. Nothing wrong. Now he is 16, and he once in a while comes see me, and he did well. He do in Texas, he do the long gun shoot. He got second place, and he swim, got first place. So his coordination perfect. I wrote his case report study. It was published in the same month because the MD doctor never heard kids disabled like him can be cured. Simple treatment, just scalp acupuncture. Exciting, encouraging for you now. Next slide. So we treat many kids. You probably ask, do you treat any kids even worse than him? Of course. This is a 2-year-old boy. When I start treating him at 2.5, he cannot sit, he cannot crawling. His hand, thumb, just like that, never move. Okay, I started. No talking, completely disabled kid from Portland, Oregon. After a few treatments, his thumb can start work, start walking, start sitting, standing, and walking. About 2 years, he is 4 years old. Look at him. Now he talk. He also has trouble to see, vision better, balance better. He can walk in his own now. He can talk very much. And so complete change in his life. We have many of them. Okay. All right. It's a one. For him, you need to put a balance areas, vision areas, upper 1/5 motor, middle 2/5 motor, and foot motor sensory areas. For people no speak at all, you use a speech one. For people able to talk, but they don't understand, they cannot remember the name, you use a speech three. For people cannot name subject, object, you use a speech two. Okay? And that is ultimate kid. The cerebral palsy for autism kids is in the movie. So we use foot motor sensory areas, speech one, speech two, speech three later. We cure many autism kids. So one in the movie occasionally say yes or no. So my wife treat him twice, I treat him twice. And he totally become normal movie. We hug each other, we answer questions, we singing. Just very rewarding, guys. It's not the business, it's nothing to do with money. You get a universal reward. Nothing better. You can see you save one kid, you save whole family life. Yeah, the parents, grandparents, they all working for our kids. For autism kids, how many we have, do you know? According to my research, there's 21.7 million kids have autism worldwide, no treatment at all. Don't think we can cure or improve 50%. Just a conservative thinking, if we can only change 20%, what? 4 million kids in our hand can become live like a normal kid. Let's do it. Okay? Work together. Next slide. Please. So we cured many of them, even don't remember. That's my slides many years ago. So we treat from 1.5 years old to 15, 16 years old. Many of them have from 5 to 15 treatment. They are normal kids, cerebral palsy. They are just now better. They are normal kids. There's many movies in our YouTube and channels and our website. You can see many links there. Okay, and so that many of them have different symptoms and very simple. Most of children, I use just 1-inch needles and use about 3 to 7 needles. If you charge $250, guess what? Each needles, you make $50 almost. It's wonderful results. Wonderful for your life and for your business too as well. Okay, next slide. We have many cases to share. We're not going to go details. For this class, I put this patient this morning. So I treated her on New Year's Eve. She is a 50-year-old female from England. She had post-COVID syndrome and vaccines reactions. Basically, her left arm paralyzed and left foot dropped for almost 2 years. Sometimes he have depression, brain fog, anxiety, poor balance, and legs swollen. That's the symptom in my mind I can think about this morning. I make a short movie already, and after class, if you're interested, we might be share that too. Yeah, a little bit clear. Guess what? How you think? How quick he can reaction? Oh, he also have some aphasia, cannot remember words, cannot open the eye. So post-COVID is big deals. 20% people have COVID, include all different type, mild, medium, severe. They have post-COVID symptoms. Most of them have what? Foggy brain, lost smell, lost taste, right? Fatigue, anxiety, depression, all kind of strange pain. And balance, dizziness, vertigo, and the most common symptoms and signs. We have treated a lot in past 3 years, have wonderful results. Most of them through 3 to 5 treatment, the most symptoms and signs can be gone. Okay, try to learn this and help more people. Okay, so beside do acupuncture, I'm a good artist. I do Chinese calligraphy on the left, a lot of painting in the background is all my paintings. So a few galleries that my painting too. So anyway, for her, during the first treatment, left arm move up, one treatment. Okay, what you do? Left arm paralyzed, what you do? Left arm, the right side of the brain have the problems. You put the needles in middle 2/5 motor areas, right? Simple. For left foot drop, you put another needle upper 1/5 motor. Okay? Can you see it? Yeah. That for drop the leg right there, between there, drop the foot, paralyzed arm. For chronic fatigue, you put a foot motor sensory areas right there. For anxiety, depression, you put in head areas. For people never take our class, you don't know head areas, you just use GV24, same areas, okay? Foot motor sensory areas should be, open that for me, should be 2 needles, and one here, and thank you. So right there, okay? Then for balance problem, you do a balance area right there. More simple. So during the way back to slides, during the first treatment, paralyzed arm and feet. It's gone. You can walking now, use a walker, start eye open, and balance much better. Anxiety so much better. After 2 treatment, anxiety, fatigue, very foggy, insomnia, lot better. And she is surprised, leg swollen better too. That picture is in 3rd treatment. I treated her the day before yesterday. So I make many clips and film her. So if you're interested, we can talk. So you can see none of acupuncture, body acupuncture, ear acupuncture, can get results like that. The whole family is so happy. The reason I treated her on New Year's Eve, because her family is my friend. You met her brother, Ricardo, in the film. He is one of the first patients we interviewed. Ricardo had stroke during his play guitar in the show. And he's a professional guitar player. So after stroke, he lost speech, balance, the right hand paralyzed, face paralyzed, leg paralyzed too. He's completely cured after 25 treatments, something like that. Anyway, he's in the movie. He completely recovered. Now he passed all the exam trainings for police academy, and he's a policeman. So his family, we become good friends. The dad called me, my daughter needs treatment from England. You have to treat him. I don't know. I don't care. New Year's Day is New Year's Eve, you have to treat her. So she is much better. Treat only 3 treatment. And we hopefully we get more improvement. Okay? Next slide. For people, lost smell, lost taste is very common. Okay? So you use the lower 2/5 sense areas. This patient, and actually his son is a CP case, and then he come in with the son, say, Jason, you have to squeeze me in. You need to treat me. We said, I don't have the room. I'm pretty busy. And he said, you have to treat me. He worked in the army. Then after he have second vaccine, he developing severe headache, cannot sleep almost at all, 1 hour or 2 per night, severe fatigue, anxiety. And this patient, sometimes he has left arm injury, so left elbow pain. It's just something else. And you can see the tongue is red. Yeah, depression, the heat in the heart, all right? Central crack is all indication some depression and anxiety. Next slide. Severe headache. He worked in the army, and he accepted all the treatment. So all kind of medications, nothing helped. Basically, he's almost crazy. What do you do about him? Next slide. So treatment, ear approachment, the liver. He also have anger too, so there's the liver. So I use foot motor sensory areas, 3 needles on the head, work on all the emotional anxiety. Upper right middle 2/5 sensory areas, treat the left elbow pain. And also I use some body acupuncture, LF4, 35, gallbladder 41, liver 2. And I believe I use stomach 8 and Taiyang point. After 1 treatment, all pain go away. After 2 treatment, don't need it. I do follow up for him 3 to 6 months later. It's normal, no pain. Okay, that post-vaccine adverse effects. And you treat them basically same like post-COVID syndrome too as well. So there's so many people have COVID now all over the world. 20% of them have post-COVID syndrome or long hauler. But give a lot of opportunity, guys. Look at that. Learn how to treat it. We're going to have a lot of patients. Okay? For me, before the COVID, we already have 6 months waiting list. They have to wait a new patient. Now you can see period of time, we just say we don't take any new patient. No way. Too many patients. Okay? You want to learn that, you want to help them, you're going to help a lot of people, probably your relative friend as well. Okay? And the treatment is so simple. In our level 1 class, now mostly online. So I teach you how to treat the post-COVID syndrome too as well. Okay? All right. That Just example, we treat many MDs, doctors, lost smell, lost taste, fatigue, anxiety, and we can make their complete recovery. Okay, very exciting. That some patient we can introduce today, and we can save some time and answer your questions. And next slide, please. The other reduce. Yeah. So anyway, scalp acupuncture, neuro-acupuncture have been proven the mostly effective technique for difficult, challenging neurological disorders. This technique, they are accessible, easy to understand, easy to study, and easy to use. It's less expensive for patient. It's very safe inside the bone, have very little or no side effect at all. So we hope in the future we can unite together to do more clinical trial research. We can uncover mystery how they work, this technique. So in order to make you more exciting, I want to introduce one more patient. Our filmmaker make a new movie last week, how to treat autism adults. They call total disabled, a young man, total disabled for 29 years, cannot communicate, cannot talk at all. And in assisted living place, I treat him last week. Look at what he looked like. Please play next film there. Thank you. And also thank you, Stephen, in back there, do a lot of work. That's one of the film we just made it for this class. Thank you. Hello, everyone. I'm Jason Hao, the president of Neuro-acupuncture Institute in America. In past 40 years, I have treated many people who suffer from difficult, challenge neurological disorders, such as stroke, multiple sclerosis, Parkinson's disease, PTSD, CRPS, cerebral palsy, and autism. What I'm doing is a special acupuncture technique called neuro-acupuncture. Neuro-acupuncture is a contemporary acupuncture technique integrating traditional needling methods with Western medicine knowledge of neuroanatomy, neurology, and neuroscience. Neuro-acupuncture has been proven to be mostly effective technique for treating neurological disorders, include paralysis, loss of speech, aphasia, loss of balance, all kind of pain, brain foggy, fatigue, anxiety, and depression. How do you get here today?
Walking.
Walking? All right. Walking here by yourself?
That's right, I sure did.
How long did you walk here?
I think it took 10 or 15 minutes.
Is that right? All right.
I sure did.
We have a 31-year-old son, Mark, who is autistic, high-functioning autistic, but definitely with issues.
How are you feeling overall?
Oh, I feel good today, which is good, because it makes me feel better with all that stuff.
We're always looking to do more for him, and John's brother, Kevin, knew Dr. Howe. So you can...
And he referred us to Dr. Howe. He thought Dr. Howe might be able to treat Mark and to improve his condition.
Mark's issues are primarily some social anxiety. He is loud noises, babies crying, people bursting out laughing unnerves him. So on airplanes, for instance, he always has to be with somebody. He generally can take a train by himself in a compartment. So his language was always rather mixed up.
The three things that have shown marked improvement. One is his language skills.
Well, I work Mondays and Thursdays. Like, I don't remember the hours.
Both his vocabulary, his sentence structure, and his syntax, and the complexity of the sentences that he uses. Dramatic improvement.
Yes.
His anxiety is diminished tremendously. He still has it, but he's much better able to control it. And the third thing is his mood. I mean, I would describe him before he started seeing Dr. Howe as being depressed a lot of the time, having a negative outlook on life. I would just say depressed. And since then, his mood has changed dramatically.
I think he used to be anxious about the next social situation. So he wanted to do things, but at the same time, he just couldn't let himself go. But we've seen, like last night we had a barbecue and Mark went up to one of his cousins and started small talk. He doesn't ever do that. I was shocked last night. I saw a huge jump. He went up and talked to her about something that happened in Austin, where she's from. I was so surprised. So that's a big, and he never would have done that a few years ago. We've seen just a lot of, I mean, it's not like he's not autistic, but just the incremental changes has made his life a lot happier, a lot more manageable. But I would say that first time he did 4 sessions in 2 weeks, and we did see improvement fairly quickly. You know, we could see it maybe. And then over the last few years, family members, friends have come up and said, I can't believe you did this. Last year, he gave a speech at his engagement party we gave for his sister. And he practiced it. It was funny. People laughed. He loved it. And where that would have been something, he never could have done something like that before.
We didn't know. We didn't have any expectations. We were just hoping that maybe Dr. Howe.
Hope, but no expectation.
I had very little. I thought, we've done so many therapies over the year.
Different types of therapies.
Yeah, OT and speech, and he's done it most of his life. And I just didn't think. But then I heard Kevin told us about this little girl and the improvement, and then some other stories. And then I just thought, well, it's not going to hurt to try it. And then within a few sessions, I was convinced that there's progress.
No, we have MDs in the family that go back over 100 years. Nobody talked to us about how
referred.
Right.
Nobody referred that.
No, and it's just not something that we've ever felt we needed. So we didn't. It's just not something we thought about. I think what helped is the neurology aspect of Dr. Howe's background. You know, we felt like he understood the brain and how it works with different parts of the body. Like when you walk in, when Mark has, I mean, he's got needles in his ankles and in his wrist, and his ear, they move all around. But he knows what to do, and whatever he's doing is really making a difference. I think he just talked to Dr. Howe and found out that he was working with people and with issues, and he knew this 6-year-old or 7-year-old with cerebral palsy out in Austin area or somewhere in Texas, and convinced the parents to come here, and they saw immediate results on a physical level.
And dramatic.
And so we thought if he can do it at a physical level, maybe he can also do it on a more
intellectual.
And the brain level, the neurology level. And we are, as long as Mark's coming here and Dr. Howe is, willing to work with him, we're going to have him come twice a week. I'm very happy
Happy
about
birthday.
Oh yeah, he told us.
So he told us too.
Really?
Your birthday?
Oh, yeah.
If you want to learn neuro-acupuncture, please visit our website at Neuro-acupunctureinstitute.org. I'm looking forward to see you in the class. Bye. See you there. All right, everyone. Out of the book, I found out if you're interested, you can go to a website and the Amazon sell that. Also, I'd like to take a few minutes to thank all many people, include my beautiful wife, and she working in other clinic in Albuquerque. she cannot join tonight's lecture. CEC pause greeting people there, Dr. Linda Hao. You're going to meet her in our class and see her beautiful technique and demonstration as well. I'd like to take this opportunity to thank all our former students. I cannot see everybody. I quickly scan, see Todd, you want the questions, Sally there. Thank you all to continue support the Institute. I know Todd get a lot of good results. We constantly refer patients to our students as well. So we have a website, have a map. After you graduate, take class, we put your all information. Patient can function, can find you. Before we go to questions, I'd like to introduce very important person for Institute, Mrs. Asia, and the executive director. You want to any further information, contact her. Here is Asia.
Hi. Hi, everyone. I want to thank you so much for coming tonight. We were so excited to have another webinar with Lhasa. Lhasa, thank you so much, Todd and Stephen and the whole team. You guys are so wonderful. I wanted to make just a couple of announcements regarding the Institute. We do have a level 1 coming up in February. So if you go to our website, neuroacupunctureinstitute.org, go to the education tab. And when you click on it, there's a drop-down menu and you'll see level 1 and level 2 listed. We're doing both level 1 and level 2 this year. You can sign up for them simultaneously, and we could talk about payment plans if that's needed. But just so you know, yeah, just give me an email. Go ahead and email me or call me. The email is Asia, ASHIA, at neuroacupunctureinstitute.org. I'm going to put it in the chat real quick in case people want to email me. But then also, Todd, if you could put, or not Todd, Stephen, if you could put that link for emails in as well, that would be fabulous. I mean, sorry, link for the film. So that link, when you go to that link, all you do is put your information in, and that'll put you on our email list to find out about more things going on at the Institute, but also it affords you a free viewing of our documentary, Return to Life, with Dr. Jason and Linda Howe. So level 1 is February 10th through 12th, 2023. Level 2, oh, and that's going to be all online. Level 2 is in person. It will be our first in person since COVID, which we are very excited about. And that'll be held in Albuquerque. Our office is in Santa Fe. And so level 2 is March 23rd through the 26th, 2023, and that will be in person. So also, yeah, please sign up for the email for Return to Life. And does anyone have any questions about the Institute for me? Just really quick, and then we can get to Dr. Howe's questions. Okay, terrific. Oh, thank you, Eric. Appreciate it. Yeah, someone reposted the link. Oh, actually, that's the link for the website. Thank you very much for posting that. I appreciate that. And so the other link we would like up again in the chat, if possible, Stephen, if you could put up that link that that goes to the email for the free film. That would be fabulous. Thank you, everyone. And let's get to questions with Dr. Howe. Thank you so much.
Asia, before you leave, thank you very much. And we did get the link that you were asking about for the movie, and we posted a couple times, and we'll continue to do so.
Awesome.
Thank you so much. Appreciate
Thank you. And thank you, everyone. Have a wonderful evening.
Well, we've got
all right. Now we're going to team up together with Todd. We're going to read the questions, and we have 30 to 40 minutes, and you're going to have tons of questions. So the answer is not us, it's the book. It's not because we wrote this book. It's a wonderful book. I have all the questions. So 1/3 is all the theory, all the chart I desire. I'm artist. And then 2/3 is all the patients I treated in 30 years in America, mostly in my workshop. I teach Chinese acupuncture practitioner. I also teach our MDs. I use a different language. That all the disease normally in acupuncture practice, you don't see those kind of people. People in coma during your class, and people completely paralyzed. For example, is all in these cases there. Okay, now we
That's
can
amazing.
do all the question and answer.
All right, doctor, that was so amazing. You provided so much information, and you are absolutely right. There are quite a few questions out here people are asking. Suzanne writes, can you treat blepharospasm?
What spasm?
Blepharospasm.
Yeah, you do. Yeah, we treat a lot of spasm. It basically use tremor areas. They work all kind of spasm. Tremor area also good for essential tremor, and for tinnitus spasm type, cerebral palsy, Parkinson. You also use tremor areas. Also, where there's a spasm, you use relative motor areas. For example, arm, you use middle 2/5 motor areas. For people leg spasm, you use upper 1/5 motor area combined with the tremor areas. Yes, and you get good results.
Fantastic. Please give us some idea for hydrocephalus in senior with walking difficulties. Hydrocephalus.
That usually you use motor areas and foot motor sensory areas. You can work on that. For people older, they always have some cerebellar balance coordination issues. So you use balance areas, both sides as well. Thank you. Good question.
Okay. Do you have any advice for treating ALS?
Who asked that question? It's a challenge.
Yeah.
ALS, yes, I get a call all the time. Actually, we got a call today from New York. They have ALS, want to come treatment. We say, no, you're not come here. Why not? We say, ALS, we get good results, but very short. Some people better for a couple hours, some people couple days, could be up to 1 week or 2 weeks. We don't have any people longer than that. Average, they have a few treatments that are better. So if people have ALS in local, I treat them. But people from out of state, from other country, I usually refer some student we are training to them in the local because they need some continued treatment. We have one patient in Santa Fe, is the end of the life. He has MS, ALS, and the head is dropped, cannot raise up. After treatment, the head can raise up for 1 week, then drop again. It hurt us. Eventually, he's gonna die. When diaphragm not working, we told the family, my wife told family, don't come back. And it's too stressful for us to see him. The family cried. He said, that's the gift that we give to him. You put needles, he had hold up for a whole week. Do it, do it. So that was ALS. Yes, short term, we get good result. Many people end up they die. Worse than to treat them. Okay, but the quality of life changed. No question about that. Okay, next.
Oh, that's great. Elizabeth writes, why not use electrostim to generate enough stimulation on the needles? I think when you were going through it and you were rubbing it, so fast.
That's a good question.
Okay.
And as well, and I believe personal, when we stimulate needles, my energy transfer my body to the needles. Okay, it's not just stimulation; it's the energy moving. So they are the best results. But for most Americans, you're busy or you don't have time to practice that fast. So electricity can work as well. Actually, I don't use electricity in the past, but past 10 years I use more and more because more report, they get good results as well. So we have special class just talk about stimulation for electricity stimulation for scalp acupuncture. Generally speaking, use electricity, you use high frequency, is a 60 hertz to 200 hertz, fast and lower intensity. You don't want to turn what? People shock, pass out, or they cause spasm, they screaming. So barely feeling a little bit vibration, that's good enough. We will have class specific talk about that. And research your hand stimulation, how to control quality about that. So for many clinical trials, they use electricity. Good question. Next.
All right. Good question. Mina writes, how often did you treat the little boy? So
that depends local or from other country, other distance. For people from local, ideally will be twice a week. Start with 2 or 3 times a week to start with. When they get much better, go once a week. But I'm very busy. I only can manage to see them once a week. For some people from out of state, out of the country, from New York, from Australia, from Dubai, they cannot come once a week. So I treat them 4 or 5 times per week. Usually new patient, I see them 4 times, 3, 4, I know their prognosis, how they're. So many people come 1 week, get treatment every day, 4 or 5 times per week. Right now, I have this week, we have one from Ohio. He has Parkinson disease. And he comes twice a year or 3 times a year, get 1 week for treatment each trip. No symptoms for almost 8 years. He's our second big donation to our institute. So if you're feeling better, your patient feeling better, they're rich, tell them donation of money. We need money to train more people. There will also have one boy from Houston, Texas today too. And 11 years old, the hand, arm have all lot of trouble. Today is a second treatment. He is much better walking now. Very exciting, the whole family. Anyway, that's the basic principle. Okay, next question.
all right. Si Yao says, is there a difference in treating children versus adults in regards to needle retention time and needle stimulation frequency and duration?
I really like that question. Smart. Sounds like you use that technique. So for the adults, mostly 30 minutes, and retention needles. You stimulate needles every 10 minutes, about 2 or 3 minutes. So you use longer needles, 1.5 inch, relative thicker needles, 32, 34. Okay? And so that for adults. For children, it's different. Number one, you use short needles, 1 inch. Thin needles, 36 mostly I use. Number two, for children, if you manage to put needles in area they're supposed to, you don't have to stimulate. They work right away. It's just like a magic show. Put there, they talk, they jump, they move around. No stimulation at the beginning of few treatment. Then by the time you might be put stimulated, you do most of them, 80%, 90%, you don't need stimulation. For children, it's hard to put needle in. If you manage to put needle in and doesn't hurt them at all, probably you want to stay a little bit longer, get better result. I mean, 14 minutes. Most of children in my clinic, in my treated, and I put needle in, and they can do anything they want. Okay, average children, again, 3 to 7 needles, average 5 needles. If you charge them $250 per needles, is it good for you? Very attractive? Do it. I can teach you how to do it. Okay, next question.
Right. Audrey writes, any success treating chronic tinnitus?
Oh, nice questions. I get answered that all the time. Tinnitus, compare people paralyzed, compare people lost of speech, balance poor, it's not that good results. So for other conditions, I probably have 80 to 90% success rate. For tinnitus, I get probably 60%. Compare my good results, it's not that good, but compare other medical professions, they're pretty happy. Generally speaking, tinnitus is acute, short history, have high pitch, excess syndrome. They have better prognosis. People have that 30 years or 40 years, they have lower pitch and chronic and a lot. It takes time, or they might be don't work at all. Usually after 3-5 treatments, I know my prognosis. So I have 2 today. They both have good results. One is from post-COVID. One is a traumatic brain injury. They're pretty happy. You see, doesn't bother me anymore because they're far away, lower pitch, lower frequency. Okay, good question. Next.
Yeah. If you have an older autistic teen who cannot speak, but was recently discovered to be a genius and can use a keyboard, but only one thumb because of apraxia, and has severe social anxiety and major trauma.
Yeah, of course they work. The map we made here, and from here, is a human being. In order to learn, we divide motor areas into upper 1/5, middle 2/5, lower 2/5 by the relative. Okay? The more we use in our everyday life, the more complex they have, more motor areas constant change. For example, past 10 years during the computer change, we all use thumb, they use mouse, they use that. This area become bigger and bigger. Yes, you can use that. Basically, the middle 2/5 areas in jaw style motor areas you can use to treat this problem. Yes, and so they have pretty good results. Like the ultimate the CP tell you that little boy, since the birth, this thumb never moved. When I started, then he start move that. He started to talk 2.5 years old. Okay, tell you that additional his story. He morning talk to parents, talk. They don't understand, and they talk. They say, he's upset. We don't understand. We say, let him talk. We say, why you want to talk to me? Tell me why you want to talk. He said, and on, and on, and on. We say, I understand what he said. He said his hand is on. That's why his hand work before it's off. Is it smart? So his arm, hand move right away. I'll give you a story. I have a lot of stories. Join the class, you enjoy it. And after class, we are now finished with you. You become family member of Neuro-acupuncture Institute. So we have WeChat, we have other special class, continue to support you, answer your questions, concerns and the movie. We support you. You're part of the family. We're going to do together, help people life. Help them what? Return to normal life, right? Okay.
Awesome. That was great. Victoria asks, how do you treat intercostal neuralgia?
intercostal neuralgia is very common, mostly from shingles, post-COVID syndrome, post-shingle syndrome. It works good. So you use sensory areas. Mostly you use upper 1/5 single areas, sensory areas, and foot motor sensory area is the number one. I often use it. Probably have 70% you can resolve the problem. For other 30%, you use a Huatujiaji point. Okay? Huatujiaji point is one level above shingles level in the spinal cord, Huatujiaji, and one below. You can use electricity stimulation. And you also can use herbs. Most common use herb was that? 龙胆泻肝丸. The damn hit in the liver, right? Mostly excess. All they have deficiency, you use 知柏地黄丸. I'm a very good herbalist too. So you're not going to only learn acupuncture. You're going to learn herbs. Also, you're going to learn this big chart, differentiation of the syndrome, that I teach that courses for you too, for after you graduate from our institute. And okay, that's that question.
Okay. Let's see. We got room for just a couple more. Do you treat mood disorders with scalp acupuncture?
Of course.
We have
most patients mood disorders. Most disorders is a very broad categories. Mostly paralyzed, mostly extensive mood, essential tremor, Parkinson's, or what is motor neuron disease. That's most of patients we treated the motor disorders, motor movement disorders is all related, paralyzed, or the abnormal moving. So you combine motor areas, sensory areas, tremor area, you can treat them. And like a motor neuron disease, I cure many of them, top MD, PhD student, and we can cure them too. So we have wonderful results. So you basically use these areas and foot motor areas. Some patients you might use balance areas because there's coordination problems. Yes, we do. I have good responses. Next.
Okay. Is there application for protracted vertigo associated with vestibular neuronitis?
Of course, we don't talk about that. That's one of the post-COVID syndrome and post-vaccine syndrome, post-concussion, traumatic brain injury, Ménière disease. That's one of the diseases. A few we can mention that. For dizziness, vertigo, scalp acupuncture have wonderful results. So the treatment very simple. So you stimulate that area between about a year, 1.5 centimeter, bilateral posterior 2 centimeter, and posterior 2 centimeter, 4 centimeter length. They call hearing and the dizziness area. They work at dizziness, vertigo, especially the type you mentioned, vertigo works well. And we treat a lot of people who have traumatic brain injury. When you treat this side, some people have diagnosed one side, some people diagnose both sides. Doesn't matter, you always treat the left side and the right side, right there. Okay? So that's the problem, basic, this part of the superior, the temporal gyrus have problem. So you need to stimulate there. And we call stimulate, you can restore, rewire the functions. When they're function normal, vertigo dizziness can go. Ménière syndrome, we can cure them. Just a few needles, a few treatment. Okay? All right, next.
All right. Erica writes, can neuroacupuncture treat seizures and cerebral palsy in adults?
This sounds like a third-year student questions. All right. Yes, we do. But treatment seizure epilepsy is very complicated. So depends where the seizure. We should have one class and probably half day just talk about that. Yes, we have good results. Depends where is the seizure original started. That you have to detect it. So most common areas you use is this one, foot motor sensory area. Okay, it's a major. So frontal type, you might be use chest areas. Temporal type, you might be use a dizzy area. Occipital type might be use a vision area. So it depends. The best results I have right now, the patient I treated today, she is a nurse. She had brain tumor surgery, after surgery nonstop and seizure. And so constantly and total disabled. And isn't she our last class? Yes, right? The nurse. Anyway, we have her. I still treat her. She don't need treatment. After 2 treatment complete stopped, and she don't need treatment. Her husband is an acupuncture practitioner in Santa Fe. Well, he said, well, rest of your life you have to see Dr. Hall. So she come to a clinic and we did a demonstration in our last online class. She cries, she tears, no, you cannot get rid of me. I have my life back. You have to treat me every week, once. Anyway, so, and that's the best results. And he work in medical field, and you can see nurse, she sends so many patients to us too. Yes, we can make a seizure less severe, less frequency, and many of them, they could completely stop. And they don't need a medication at all. Two, we treat the children and the adults. But it's very complicated to treat it. Okay? All right. Question?
Well, doctor, thank you so much. We're just about out of time, so I don't know. The questions keep coming in. How would people get a hold of you if they have further questions? What's the best way to reach you?
You have tons of questions. The answer is,
yeah.
Don't send any question. You don't get an answer. I'm honest. Because we have too many patients. I have my life, and every day I have so many emails. Patient, practitioner. Again, that's your answer.
Get the book. There you go.
All right. Yeah, your teacher, you want your teacher long life, share the story, the technique longer. You don't want to get too stressed, die early. So I taught my student too, don't send my question. Do anything. That is a Todd, Sally, they all communicate. You become lifetime the NAI family, brother, sister. You're going to support each other. And we do have other teacher, supervisor help you too. Well, but don't send any questions. You're not going to get an answer. I'm honest. Sorry about that.
That's fantastic. That is a good, honest answer. So they should probably sign up and take the course. Go to the
the answer is you take course. Even in the course, basically during my teacher first 2 hours, no questions. Your question, your answer by the time you learn more. And many diseases like Charcot-Marie-Tooth syndrome. How did you treat it? You got to call, hey doctor, how can you treat Charcot-Marie-Tooth syndrome? Many of them you probably never heard about that, right? Then you have to learn your own. You have to go to a dictionary, look at that. Charcot-Marie-Tooth syndrome is a syndrome that affects Americans. They drop the food. Oh, they look like a multiple sclerosis. Then you say, yes, I treat it. Then you treat it 1, treat 2, you can cure them. As a example. You learn by practice as well. You also learn a lot from your patient as well. Thank you.
Okay. Doctor, thank you again for everything that you've shared with us. It's very informative, and it was amazing to hear some of the stories and all the connected. I liked how the practitioners and everybody who's been writing questions seems to be writing very well, and the connection between you and them is really strong. So thank you for for being so thorough with your responses. And
It's
you
a
also
wonderful
had-
team. We're very glad, very happy. You can see I'm very excited working with you, Todd, and back the technician Steven and Asia. We're a good team. We're looking forward to next class with you in a couple months. Thank you, everybody, to join us in our live. And we have more than 1,000 people on YouTube. Thank you all, and looking forward to see you all. And we're together. We'll help more people, change more people's life, return their normal life. Thank you again.
All right. Thank you. Happy New Year.
Happy New Year, everyone. Happy Chinese New Year, the year of the rat. What rat? The rat know how to swim? Yeah. I don't know. Anyway, thank you.